President Joe Biden leading the nation in marking a grim milestone in the coronavirus pandemic, holding a candlelight ceremony at the White House as the U.S. death toll hits 500,000 dead Americans. You see the candles there. It is the highest reported death toll for any country. Biden promising that the nation will beat the virus, but saying to never forget the Americans who lost their lives to COVID.
This nation will smile again. This nation will know sunny days again. This nation will know joy again. And as we do, we'll remember each person we've lost, the lives they lived, the loved ones they left behind. We will get through this, I promise you.
500,000 Americans is about the population of the city of Atlanta, Georgia. It is more than the combined losses in 2 world wars in Vietnam for the United States. It is a number that, frankly, for every single one of us was unimaginable a year ago. In fact, here in the United States 1 year ago today, there were only 35 reported cases and there were no deaths. No deaths. 1 day later, former President Trump said that there was nothing to worry about.
We have it very much under control in this country.
And since he said that, 500,000 Americans have died. Caitlin Collins is out front tonight. Caitlin, Trump did, try to distance himself from the pandemic. He tried to downplay it. He's admitted that, obviously, in interviews. It is a very different story with President Biden, who is banking his entire presidency on COVID and leading the country out of it.
Yeah, President Biden has said that he knows that his time in office will be judged on his response to this pandemic. And I think so will former President Trump's and how he responded a year ago and what could have been different had he not downplayed it in the way that he did. And you saw just how different their leadership tones are today. The way that President Biden came out, he spoke. Aaron, he said that he gets a little card every day that he carries around with him with his schedule that says the number of infections in the United States and the number of deaths from coronavirus in the United States. And every day he says he looks at that. And of course, seeing him come out there tonight where those 500 candles are each one representing 1,000 people who have died from coronavirus, I couldn't help but think that that is the same spot where former President Trump accepted the Republican nomination last summer in front of this massive crowd on the South Lawn, a lot of people not wearing a mask while we were there. And just to see how different it is now with President Biden and, of course, Vice President Harris also out there. And so we should note that today, as they were trying to mark this, they also lowered the flags at the White House to have staff and all flags on federal grounds for the next several days. This also comes as he is still pushing for that coronavirus relief bill to get passed on Capitol Hill. We're expecting a vote on it in the House later this week. But you are just seeing on this week, on this day, just how different President Biden's response is to this and how he is trying to be much more empathetic than his predecessor was.
All right, Caitlin, thank you. And I want to go now to 2 doctors that we've been following the pandemic with since the beginning, and you have seen them on this network on some of the darkest days. Dr. Craig Spencer, Director of Global Health and Emergency Medicine at Columbia University Medical Center, who just completed a shift in the ER, and Dr. Murtaza Akhtar, an emergency room physician who's been treating COVID patients in hospitals across the country. Dr. Spencer, let me start with you. You know, when the pandemic first hit last spring, you were at the center of it here in New York. And as bad as it was in New York and across the country, you know, when you think back a year ago, did you ever think that we would hit 500,000 people dead from this virus?
Absolutely not. Even, less than a year ago, Dr. Fauci warned that we may reach 240,000 deaths, and we've doubled that. We've gone through such horrible pain here as a country, and we're going to need to have a moment of national grieving. The way that I'm thinking of this is when I worked in West Africa in 2014 treating Ebola patients. When you go there, you don't touch anyone. You're not allowed to have physical contact. And at first it's strange, but eventually you get used to it. And then you come back to the US and you touch people and you're physical again. And it's very unsettling. And I feel like in a sense, we're in the same scenario where we're in this limbo, in this crisis, and that people are undermining how difficult it's going to be to go back to a sense of normalcy, despite how much we want it. And part of that is because 500,000 of our friends and loved ones are no longer going to be here when this crisis fades. And I think we all need to keep that in mind as this passes, that we're going to have to think about how we memorialize and think of all the people, friends, colleagues, loved ones that we've lost.
Dr. Fauci was asked today about this horrible milestone and whether more could have been done, right? And we know that, yes, more could have been done, but I wanted to play exactly how he said it today.
500,000 Americans, families grieving all across the country. Did this have to be?
Well, certainly some of it, but not this bad, George. I mean, I believe that if you look back historically, we've done worse than most any other country. And we're a highly developed, rich country.
And Dr. worse than any other country, and we are the richest country in the world by so many measures. How many of these deaths do you think, I mean, when you look at all those shifts you've done in the ER could have been prevented?
Yeah, I mean, that's a great question. And the best way of preventing those deaths would have been preventing the infections to begin with. And really the best way of looking at it is comparing with other countries, and people have done that. Even if you compare to our European counterparts, we've done far worse. And let me tell you a statistic here, Aaron. If you compare it to how Taiwan did, of the 500,000 we lost, if we acted like Taiwan, we would have saved 499,900 of them. I know that sounds phenomenal. How could that possibly be? But that's how marked a difference our country has had versus some of the other countries that did so well. I'm not saying we necessarily need to shoot to be number one. We should be, but to be as low as we have been cost hundreds of thousands of lives that really could have been prevented. It's not maybe would have been prevented from dying.
It's incredible. I mean, Dr. Spencer, the CDC director today, Dr. Walensky, said the 7-day average for cases, right, has dropped by, 3/4 since January 11th. 7-day average for hospitalizations down 60%. We've seen a plunge in all of these metrics and deaths as well. What do you think is behind these declines?
I think there's a lot of things. One is that we're vaccinating people, 1.5, 1.7 million people per day. We've already had probably over 80 million Americans who have been infected with COVID and have some level of protection against reinfection. But the statistics that you point out, let's remember that they're much better than they were a few weeks ago, and that's certainly heartening, but they're still not great, right? The 7-day average for cases is the same as it was in the summer, and that's the same for hospitalizations. I'm glad that we're going in the right direction, but this is not a time for complacency. The best way for us to get back to normal is to double down right now, not to throw off our masks, not to eat indoors, not to do other things that we know can risk reigniting outbreaks. The majority of people in this country, despite previous infections and despite 2 months of vaccines, the majority of people still have no protection against COVID and can get infected and can continue to spread throughout this country. So we need to double down right now. That's not to instill fear. That's to let people know that this isn't over and we need to double down.
Well, it's a pretty powerful point you make to remind people, right? We're where we were last summer. Everyone remembers how that was. Mm-hmm. Yes, there's a vaccine now, but those were dark times. Dr. Akhtar, are you optimistic about the trends, or do you think that some of these numbers, as good as they may look, could be deceiving?
I completely agree with Dr. Spencer. I'm glad he said that because I thought maybe I was going crazy. Yes, the numbers, if you look at it for just the last week or two, look great. But COVID hasn't been around for the last week or two. It's been around for almost a year at least. And if you look at that whole graph, as Dr. Spencer mentioned, we are basically have gone down to the levels that we were at the peak of the summer. Remember, in the peak of the summer, Aaron, is when you had me on your show a lot because of how terrible things were in Arizona and how terrible things were in the country. And so now for us to say, look how good things are, I guess we've taken this as our new normal, that we're just going to have a ton of hospitalizations, we're going to have a ton of cases, and we're going to have a ton of deaths, and let it be okay. It's clearly not okay. I'm glad it's trending in the right direction. But remember, those waves came down before, and when the next wave came, it was even worse. So a lot of the reason we've had this downtrend is because of the holiday surge. I'm really hoping that it continues to go down. But as you can imagine, at this point, I hate to say it, I'm a little bit pessimistic about how things will go.
All right. Well, I appreciate both of you taking the time. Thank you very much.